I am all for it.
I don't get that, because it's just all of your public health officials, your administration, they're in unison about this. No. They're all in unison about it. The University of Washington, which is they have a model that your coronavirus task force relies on, says that if everyone wore a mask, you could cut expected deaths in half.
And then you have other people that disagree.
Well, what does that mean?
Scott Atkins, if you look at Scott, Dr. Scott, he's from great guy, Stanford. He will tell you that he disagrees with you.
He's not an infectious disease expert.
No, I don't know. Look, he's an expert. He's one of the great experts of the world.
I only have a few seconds, but how contagious is it? We see all these images of people wearing those face masks. First of all, are those effective to prevent the spread? And second of all, is that necessary?
Well, in general, those kinds of masks that you just get in a store don't keep the virus out. Probably the one thing they do the most is they prevent you from touching your nose and your face, which is even more important than trying to keep out virus with a mask.
Today with Dr. Anthony Fauci, who's the director of the National Institute for Allergy and Infectious Diseases.
So right now, don't worry about it. Be more concerned about influenza, which is going into a second peak for the season, than coronavirus. But keeping masks now is just not relevant. You don't need to be walking around with a mask right now. Masks, quite frankly, are more important for people who are infected to prevent them from infecting someone else.
And hopefully they would get a better mask than the drugstore sells?
Right. The drugstore masks that sell have a lot of loopholes in them that let the virus through.
Okay.
And in supermarkets, people are increasingly wearing face masks, just as a precaution.
Wearing masks like that is wasting a mask. That's a mask that won't be available when it's actually needed.
The state government's advice on wearing face masks is in line with the World Health Organization. Under its guidelines, masks should only be worn if you have a cough, fever and difficulty breathing, or if you are healthy and taking care of someone with these symptoms, and or someone with a confirmed case of COVID-19.
If you do not have these symptoms, you do not have to wear masks, because there is no evidence that they protect people who are not sick.
And we are committed to answering your questions about the virus. The outbreak has many of you asking, do I need to wear a face mask? The answer, no. The CDC does not recommend the routine use of face masks in the community. Instead, it wants everyone to avoid people who are sick. Avoid touching your eyes or nose and cover your cough or sneeze with a tissue. People who are sick should stay home and not go into crowded public places or visit people in hospitals.
Do not get a flu shot, and the flu right now is far deadlier. So if you're freaked out at all about the coronavirus, you should be more concerned about the flu, and you can actually do something about it and get a flu shot.
15,000 people roughly have already died of the flu this season. A couple years ago, 60,000 people died of the flu.